Hello, my name is Jessica Bowie, and this is a presentation for PY 232 Abnormal Psychology. It is the course project, and it is a community workshop presentation. So, here we go. Okay, hello, my name is Jessica Bowie, and I am a clinical psychologist specializing in children mood disorders. Today's workshop, we're going to focus on DMDD, which is Disruptive Mood Dysregulation Disorder. And we're going to really focus in on some foster children and how they are affected, particularly with the DMDD. And I really hope that today, as a school staff member, you will leave here feeling well equipped with some information and tools and resources to really support these members of our school community. So without further ado, let's jump into it. Okay, so let's start with the basics. What is DMDD? DMDD is a childhood mood disorder. We're going to see that it's characterized by chronic irritability and frequent, severe temper outbursts. These symptoms often begin before the age of 10, and they must be present in more than one setting, such as home and school, to meet diagnostic criteria. It's especially common among foster children who may have experienced trauma or often instability. So let's go over some factors that may contribute to the diagnosis. DMDD in foster children often results from a mix of biological, psychological, and social factors. Biologically, neurodevelopmental challenges and genetic predispositions can play a role. Psychologically, trauma, attachment issues contribute to emotional dysregulation. And socially, the instability in foster care placements and inconsistent caregiving can exacerbate mood, stability, making it more challenging for these children to manage their emotions. So I want to go a little bit deeper here and look into the details of what the DSM-5 diagnostic criteria are. The DSM-5 outlines the specific criteria, and we know that one of the symptoms is the severe temper outbursts. The DSM-5 is going to go a step further, and we're going to need to see that those children are having these severe temper outbursts at least 3 times a week, along with the persistent irritability or anger between the outbursts. And symptoms must begin before the age of 10, but cannot be diagnosed before the age of 6 or after the age of 18. These criteria help differentiate DMDD from other mood disorders that they are similar to, such as bipolar disorder and also ADHD. Now, of course, for us to be able to give them the support and the treatment that they can best benefit from, it's really important for us to focus in on some evidence-based treatments. The evidence-based treatments for DMDD include cognitive behavioral therapy, also known as CBT. This is going to teach them coping skills for managing their mood swings. Trauma-informed care is crucial and essential for foster children with DMDD, as it helps address underlying trauma that may contribute to the emotional dysregulation. In more severe cases, medication may be prescribed, but it should always be combined with therapy for the best outcomes. Now, how can we support these children with DMDD? Again, we want to make sure that we are using trauma-informed approaches. These trauma-informed approaches really recognize that many behaviors may be responses to trauma rather than defiance. We're going to set up consistent rules and boundaries to help the children feel secure. And we're really going to be encouraging positive peer interactions through social skills, training, and also peer support programs. These can really improve their emotional regulation over time. I want to leave you with some local community resources in your area. We have Maine Behavioral Health Care and also Spurwink Services. These both provide essential mental health support for foster children with mood disorders. The Maine Behavioral Health Care offers trauma-informed therapy, while Spurwink provides therapeutic schools and in-home care. However, as in all things, there are some places that these two resources could improve. If it was up to me, I would suggest that they add DMDD specific interventions and also some peer support programs. So in conclusion, it's really important that understanding and effectively supporting children with DMDD, especially those in foster care, we need to understand that it's critical for their academic and social success. By using the trauma-informed, evidence-based strategies and collaborating with local resources, you as school staff can really help foster children manage their emotions and build healthier futures. I know that as somebody that is working in a school system, you want the absolute best for every child you work with. And I just really hope that you were able to gain some information today that will help you with these particular children that are in foster care and also struggling with some mood disorders, and in particular DMDD. So please grab a pamphlet on your way out, and if you have any questions, I'd be more than happy to stay and answer them. Thank you so much. And here's the reference list for all of the resources that I use to compile my presentation. Thank you.